to make a continuous ah sound so you keep your airway open. After clearing, inhale your first breath gently and cautiously, in case there's residual water. If you release your second stage, depending upon your position, it may drop in front of you or it may end up behind your shoulder out of sight. To recover with the arm sweep method, in a relatively upright position like this, lower your right shoulder. Extend your right arm backward along your cylinder, then sweep outward like this to locate the hose. Follow the hose to the second stage, replace and clear it. With the reach method, reach back to the first stage, find where the hose attaches and follow it out like this. It sometimes helps to lift the cylinder up and to the right with your left hand. With either method, blow bubbles when the regulator is not in your mouth. When swimming, a dropped regulator usually hangs in front of you where it's easy to find. But if you ever have difficulty relocating your second stage, don't waste time trying to find it. Just switch to your alternate air source and then get your buddy to help. It's normal for some water to trickle into your mask, but it's easy to get rid of it. Hold the top of your mask, then while exhaling slowly and steadily through your nose, look upward. Your breath forces the water out the bottom edge of your mask. Start exhaling before you look up so you don't get a little water in your nose. Some masks have a purge valve for clearing. If yours does, hold the mask firmly against your face and look down while exhaling. The water goes out the valve. By the way, if you normally wear contact lenses but can see well enough without them, you may want to have them out during your training dives. But if you need them, tell your instructor and keep your eyes closed so you don't lose them when learning to clear your mask. Use your SPG to manage your air supply at all times. With good air monitoring and management habits, you avoid running out of air, so they're obviously important habits to develop. With a full cylinder, your SPG reads close to the cylinder working pressure. Pay attention to how fast you use your air. You'll notice you use it faster as you exert more and when you dive deeper. With experience, you get a feel for how much air you use. Also with experience, you'll use less air as you relax, control your buoyancy better, and move more efficiently. Note the caution zone, which indicates when you have 50 bar or 500 psi left. If your SPG is part of your computer, the display may blink or have some other alert. This is your reserve pressure. You plan and execute dives so you have at least this remaining after you're out of the water. During training, alert your instructor when you're getting close to 50 bar or 500 psi. Your instructor may ask for alerts at other pressures. During the course, you'll learn to turn the dive, that is, head back to the boat or shore, based on your remaining air supply. You learned about equalization earlier. Recall that you need to equalize as you descend to avoid squeezes. Equalize gently and often, every meter or few feet. Equalize your mask by blowing into it from your nose. Descend slowly and be patient. Do not use long, forceful equalization, which can damage your ears and cause hearing loss. If you have difficulty equalizing, stop your descent, signal your buddy and your instructor, ascend a bit and try again. After equalizing, descend more slowly and equalize more often. Never continue descending if you can't equalize. The most popular dive kick is the flutter kick. To do this without wasted effort, starting neutrally buoyant, horizontal and level, kick from the hip with your arms at your side or against your body, like this. Your knee doesn't bend much, and it's a slow, long kick. Stay well above the bottom so you don't damage fragile organisms. You may learn other kicks depending upon your preferences or to meet specific needs. This is the frog kick. Many experienced divers use it most of the time instead of the flutter kick. With proper air management, an air supply emergency should be highly unlikely. But as a diver, you'll know how to manage the problem should it occur. Were you to find yourself out of air, if possible, you would use an alternate air source, most commonly provided by your buddy. Signal out of air and share air. Your buddy responds by providing her alternate second stage, though you can secure it yourself if she doesn't. If your buddy uses an alternate inflator regulator, she switches to it and provides you the primary from her mouth. Either way, secure the alternate, clear it, and begin breathing. Grip each other's right forearms like this. This keeps you together and leaves your left hand free to deflate your BCD and control your buoyancy as you ascend. Take just a moment to get settled if you need to, then ascend at a safe rate to the surface. You'll learn to ascend at a safe rate with your buddy. Signal up to your buddy. Start your ascend by swimming upward. You should not need to put air in your BCD. As you come up, look up, reach up, and come up slowly, like this, staying with your buddy and checking overhead regularly. Breathe normally and don't hold your breath. Ascend slowly. Your computer may warn you if you go too fast. Remember what you learned about expanding air? As you come up, the air in your BCD expands, so you have to vent some to keep from becoming too buoyant. Release small, regular bursts like this. During your first confined water dive, your instructor may do this for you. When you reach the surface, keep breathing from your regulator while you inflate your BCD. Once you're floating comfortably, you can switch to your snorkel. Again, make a habit of keeping your mask on and either your snorkel or regulator in your mouth while at the surface. If you need to float in an emergency, one option is to drop your weights, especially if you don't have air in your cylinder or have a BCD problem. Never hesitate to drop your weights at the surface. Remember, you don't have to drop all your weight, just enough to float. Dropping your weight underwater risks an uncontrolled rapid ascent, so you only do it if you're unsure you could reach the surface any other way. When you practice with your instructor, first make sure no one's below you. Breathe from your regulator and simulate a BCD problem by deflating it. You may have to kick to stay up. Then, quick release your weight, pull it well clear, and drop it. You'll float right up. After surfacing in an out-of-air emergency, or if you disconnected a runaway inflator, your BCD low-pressure inflator won't work, so you use oral inflation. At the surface, hold the BCD inflator-deflator with your left hand. Inflate by blowing into it while depressing the same button you usually use to deflate. Remove your mouthpiece, kick upward taking a breath, and blow about half to 2/3 of it into your BCD as you settle back into the water, like this. Repeat this until you're positively buoyant. Be sure to release the deflator button when you're not blowing in. Otherwise, the BCD will deflate, of course. How you exit the water depends upon the environment and your physical needs. You'll probably learn and practice several techniques. The following guidelines apply to most exits. 1. Establish positive buoyancy before switching to your snorkel. 2. Remove your fins before exiting, if appropriate for the technique. This helps you avoid walking with fins on. 3. Keep your mask on and breathe from your snorkel or regulator until you're on the boat or in calm water shallow enough in which to stand. After exiting, if you didn't take your fins off before exiting, sit as soon as you can or take them off with a buddy. It's usually easiest to get out of your gear seated. though buddies sometimes help each other while standing. Remember to use proper lift techniques, and on a boat, secure your equipment so it can't fall. When you're ready to take your gear apart, start by closing the cylinder valve. Depressurize the regulator by pressing the purge. Then disconnect the low pressure hose from the BCD inflator. Remove the first stage. Dry the dust cap and replace it. Take weights from the weight system and secure all the BCD buckles and straps. Release the cylinder band and slide off the BCD. Resecure the cylinder, or on shore, lay it down. Rinse everything like you've already learned.